So now we are going to perform the arthrocentesis procedure. You can see the straight line drawn from the lateral canthus of the eye to the tragus of the ear, and we have marked 2 points. The first point is a posterior point located 10 mm from the tragal and 2 mm inferior, that is below to the canthotragal line. This point corresponds to the posterior extent of the glenoid fossa. Now the second point is marked 20 mm in front of the tragus and 10 mm below the same line, that is the canthotragal line. This marking indicates the articular eminence. So this line is called as Holman and Helsing line, and this is the most important viva question. And after marking this line and the points, and the sterile painting is done using 5% betadine. We have used 18 gauge needle for the procedure. So we can see the two 18 gauge needles are inserted in the anterior as well as in the posterior regions of the upper joint space. While inserting the needle, we should be very careful because the glenoid fossa is very thin, within the range of 0.5 to 1.5 mm, and moreover the dura and the temporal lobe are located just beneath the glenoid fossa. In degenerative condition, the joints may be eroded by degenerative arthritis or previous infection, so it is possible that during the procedure the structure may get perforated because of the needle. Therefore, the surgeon must be very cautious not to insert the needle much into the joint space. About 25 mm, that is 20 to 25 mm depth is enough to reach the upper joint space. So now through the posterior needle, we are inserting the ringer lactate solution, that is a Hartmann solution, which is injected into the superior joint space. And the second needle acts as an outflow portal, which you can see clearly in this video, which allows a lavage of the joint cavity. So coming to the topic arthrocentesis, it is a minimally invasive procedure which is suggested for the patients who are not responding to the conservative therapies. So this is generally termed as a lavage of TM joint. So without even viewing the joint space, we are using the sterile needle and the sterile irrigants to reduce the pain by removing the inflammatory mediators from the joint to increase the mandibular mobility. So there are many techniques in arthrocentesis: 2 needle, single needle technique. Many authors prefer single needle rather than 2 needle because of its pros and cons. So ideally 3 to 5 cycles is recommended, and every cycle in a gap of 1 month. So monthly 1 cycle of arthrocentesis is recommended for the better result. So in addition to the ringer lactate solution, there are many studies emerging in the recent advances with the use of hyaluronic acid, corticosteroids, PRP, bone marrow concentrate, PRF, and tenoxicam as an intracapsular injection of TMJ. So these are the most common adjuvant injection which is given during arthrocentesis following the ringer lactate solution for the better outcome. So for this patient, during the first cycle of arthrocentesis, we have given corticosteroid as an adjuvant intracapsular injection, and during the second cycle we are planning to give the PRP. So the most common complication is injury to the facial nerve due to the needle insertion. So that's why many authors prefer single needle technique. Secondly is the aortic injury because the TMJ is close to the ear. So the patient may develop partial hearing loss or may feel the fullness of the ear. Another complication may include the perforation into the external auditory canal or the tympanic membrane, or blood clots in the external auditory canal. So these are the otologic complication, and other complication includes edema due to the leakage of the lavage fluid into the extra-auricular space, and acute joint inflammation may be there, preauricular edema, redness, and some patients may develop restricted mouth opening and allergic reaction mainly due to the drugs which is used as an adjuvant, or mainly due to the anesthetic drug. In rare cases, needle breakage may happen, intracranial perforation. So the surgeon must be very cautious when introducing the needle, as I mentioned earlier. The other complications are injury to the superficial temporal artery resulting in aneurysm or development of AV fistula and bleeding into the joint. Patient may also develop preauricular hematoma or extradural hematoma. So coming to the conclusion, the surgeon must be very cautious when performing arthrocentesis. Though the procedure may look very simple and non-invasive, but still it's technique sensitive. Thank you.